Ever wonder about whether medications may help your mental health? When should they even be considered? Can they possibly do more harm than good? What should you expect or not expect when starting them? And the big question, are they safe? Welcome back, friends, to Shrink Talk with Dr. Robert, hosted by me, Dr. Robert, a board-certified psychiatrist. And in today's video, we'll be discussing the role of medications in mental health treatment. So let's get started. All right, before we jump into it, I think it's useful to acknowledge that this is a very broad, very nuanced topic that I could probably make dozens of videos about. Heck, I probably will make dozens of videos about it. And at least for today's video, it's useful just to acknowledge that I'll keep things broad and general and just kind of give an overview of this large topic and lay the groundwork for future videos. So what role do medications play in your mental health treatment? Well, here's the thing. Everybody's mental health journey is unique to them. So the role of medications will vary from person to person. Even if their situations and symptoms may be similar, they'll still be different, and it may even vary in the same individual depending on what phase of life they're in. As a general rule, the more severe, the more distressing your mental health symptoms, the more likely it is that medications may play a positive role in your mental health journey. And that doesn't need to be scary. In fact, I like to reframe that as a positive because it means we then have a tool at our disposal that may greatly reduce the quality of your life and reduce your symptoms and get you back to living the life you want to live. And that's because medications are tools to help your mental health. They're not crutches and certainly not signs of weakness. That's just mental health stigma that we're definitely trying to move away from. But I always like to remind people, though they are a tool to improve your mental health, they should never be the only tool. Because after all, therapy, lifestyle changes, exercise, diet, your relationships and hobbies, all of those things will go together and, along with the medication possibly, to improve your mental health. And oftentimes, it's the medication that makes those changes to your daily life all the more possible. So for example, ADHD, right? A stimulant may be a very useful tool to help you get more organized, help you be more on time to your therapy appointments, answer emails, right? Keep the job that you have so that you don't lose it in your health insurance and all the treatment that comes along with that. Or an SSRI may reduce your anxiety enough that you can get back to hanging out with your friends, meeting new people, or reducing your depression symptoms so that you're able to get out of bed and start exercising again and eating healthy. So medications oftentimes facilitate the other positive aspects in your life that may feel out of reach when you are struggling with your mental health. So when should medications even be considered? Simple question, simple answer. If you're even considering whether medication should be started or would be useful, that's reason enough to seek out the opinion of a mental health provider out there and get their take on it. If you're already seeing a therapist, a psychiatrist, even a primary care doctor, that might be reason enough to ask about whether it would be helpful, what sort of things you're going through in your life, and get their take on, is this something that should be considered or possibly not? There should be no suffering threshold that you have to reach to feel bad enough to ask about it or seek out help. Now, let's talk expectations when it comes to starting a new medication. Whenever I start anybody on a new medication, I kind of try to straddle two opposing lines of thought. So one, I give them hope. I offer up some hope that there is a medication or medications we can try that will most likely improve their symptoms, reduce their anxiety, their depression, or whatever they're struggling with. I reassure them that no, they're not alone in struggling with this. Things are certainly not hopeless, and absolutely we can get them feeling better. In 5 years of experience, I've yet to have someone where I'm like, okay, this case is hopeless. That doesn't happen. Because there's always hope for improving your symptoms, for feeling more gratitude, more fulfillment in your life. Every day that I see my patients, I get to witness the benefits that they experience from these medications, from their therapy, from lifestyle changes. I do very much believe that medications for some people in certain situations can greatly reduce their suffering. But then I also make sure to temper people's expectations. Because there is no miracle pill. There's no miracle medication that's going to make all your anxiety go away, your depression just evaporate, your ADHD to just disappear. It doesn't work like that. And sometimes there's some trial and error, trying a few medications until you find what works for you. And that's okay, because mental health isn't a finish line, it's a process. It's a constant journey that you navigate throughout your life. It's like I mentioned before, medications oftentimes, the way they really help is they allow therapy to stick more, allow the skills you learn in therapy to be more accessible, be more useful. It can also really help you make the lifestyle changes that before seemed impossible. So no magic fixes. And then the big concern, are they safe? So this is a big question, right? And to address it very broadly, I will say yes. For the most part, psychiatric medications are fairly safe. That being said, of course, all medications, anything you put into your body, comes with some risks and some benefits. The key is informed decision making. For example, SSRI is the most common medication psychiatrists prescribe. So things like Prozac, Zoloft, Lexapro are very well tolerated, very safe. And the side effects that do come with SSRIs are often temporary, or if they do persist, they go away once you reduce the dose or switch medication. Then other classes of psychiatric medications like antipsychotics, mood stabilizers certainly do come with a higher side effect profile. And in some cases, they can even come with some life-threatening side effects, like in the case of clozapine. But we reach for those medications with the higher side effect profiles if someone's symptoms really do warrant those kind of medications, because otherwise life and functioning may be really, really limited. And this takes me to my main point about psychiatric medications. And that's that it should always feel like a collaboration with your provider. It shouldn't feel like something you're forced to do or just given a prescription without much explanation or reassurance as to what to expect, or that you'll get your questions answered if any do arise after starting it. Because you should never feel rushed. You should never feel like you have to just take the pill and put up with anything that comes as a consequence of it. You should always feel like you can always reach out to this provider and ask if any issue does come up. All right, friends, so that's my quick spiel on psychiatric medications. They're tools, sometimes essential ones, but they're never the whole story. So leave comments down below. Let me know what's the main thing you wish people knew about psychiatric medications. What questions may you have about meds? Or if you're feeling daring enough, share your trials with medications. And if you like this, hit the like button down below, subscribe, and keep watching the videos. I got a lot more to say on this topic and many other mental health topics. Thanks so much for sticking around to the end, my friends. I really appreciate it. I'll see you next week.